All right, let's get started. So welcome everyone. Thank you for joining us this morning for our webinar on the resources for employers, COVID-19 updates and vaccination access. We'd like to give a huge thank you to our sponsor of this webinar, the UC Davis Western Center for Agricultural Health and Safety. So thank you for their support and helping us bring this information to you. We are presenting this in Spanish as well. We have simultaneous interpretation available. Para escuchar en español, busca la barra de herramientas en la parte de abajo de su pantalla y haz clic en el botón del globo que dice Interpretation y elige español o puede que dice Spanish. This morning, we're going to have two presenters. We will be taking questions after each presenter. So first, we'll be welcoming up Dr. Trinidad Solis. She's a public health physician with the Fresno County Department of Public Health. She coordinates Fresno County's efforts to protect farm workers from COVID-19 through partnerships with community-based organizations and ag businesses. Dr. Solis earned her undergraduate degree from Stanford, medical degree from UCSF, completed her residency at UCLA, and obtained her Master of Public Health degree from Johns Hopkins University. Dr. Solis will be presenting first, then we'll take questions immediately after. So be sure to put your questions in that Q&A option. And then after that, we'll be joined by Maria Ibarra. She's an outreach specialist with the California Farmworker Foundation, focusing on bringing resources to the field, such as PPE, COVID-19 testing, and vaccinations. Maria's experience coming from a family of farm workers and working in the fields herself growing up provides direct connection to core issues and enhances her ability to think outside the box, to offer solutions and create opportunities for farm workers. As I mentioned, we will be taking questions throughout. We'll have Dr. Solis present, take questions, and then Maria Ibarra will present and we'll take questions again. So please throughout use that Q&A to send in your questions. With that, I'm going to stop my share and invite up Dr. Solis.
Great, thanks, Kimberly, and good morning to everyone. I'm excited to be here with you all. And then Kimberly, if we can start sharing the PowerPoint. So Kimberly's gonna help me out with my, here we go, PowerPoint. And before I begin, I just wanna say a little bit more about myself. So I am a public health physician here at Fresno County Department of Public Health. And part of my duties include working with our ag businesses. Earlier on, in the pandemic, that included increasing access to COVID testing at the workplace and at community events. And then with the COVID vaccines rolled out, that also included helping our employers host workplace vaccination events, and really just keeping them up to date, because as we all know, this COVID pandemic situation changes regularly, and it's always a good idea to be up to date. And that's what I plan to do today as well with you all. I'm also a family medicine physician and I see patients here in Fresno. So it's, I think for me, it's really helpful to get both perspectives, like clinical, but also public health and being out in the community. Alrighty, well, so I'm going to start off by giving you all an overview of what's happening in California, because I also do collaborate a lot with the California Department of Public Health, and then also give you another perspective about what's happening in the Central Valley, which is where a lot of our ag partners work. So next slide. All right, so this is from the California Department of Public Health, and I wanted to start off with just giving an overview of the COVID-19 cases and deaths in California as a whole. And to the left, it says, you know, confirmed cases in California, and as you can see, it tracks it from March 3/1 of 2020, so around the beginning of the pandemic, all the way to 9/1, 2021. As you can see, it goes up and down, and that's really telling us the different surges. And from 12 to 3/1, that was the really bad surge that happened last winter. It was before the COVID vaccines were available. And then they became accessible to the public. And as you can see, from 12/1 to 3/1, there was a huge decline, and then we were doing really good. June 15th came around, the state reopened, and but then and I'll go into it a little later, but variants, you know, with COVID, every time someone gets infected, there's a chance of a variant developing. So around late June, July, the Delta variant arrived in the US and became the dominant strain. So in California, the Delta variant then throughout California, it is the dominant strain, and really started infecting people who were not vaccinated. And that's why, as you can see, after 6/1 on the left side, it started to increase again, and several hospitals became overwhelmed. And so there was a big surge, and California as a whole started to come down. We're starting to see those cases level off on the left, as you can see. So around 9/1 is coming down. To the right, there's a graph that talks about, unfortunately, deaths. As we have seen, this pandemic, this coronavirus that causes COVID-19 has been a very deadly virus. And usually when there's a big rise in hospitalizations, weeks later, we start to see an increase in deaths. So we just saw a big surge in our hospitals, and we're watching how the deaths pan out. This surge around, we saw a lot more younger people in the hospitals than we did earlier in the pandemic. And as I was mentioning, a lot of these younger individuals, 20 to 50 years old, were not vaccinated. So next slide. And this is a breakdown of hospitalizations. The other one was cases. And to your left, again, it shows a similar pattern where we saw, like, from the beginning of the pandemic for 2020 to now 2021, we have these peaks and decreases. And as you can see, there is a large increase in hospitalizations as well during this last surge because of the Delta variant. And then there, as a whole, the state of California tracks how many ICU beds are available throughout the state. And during some of these surges, there's areas in our state, certain counties, that didn't have any ICU beds available at certain times. So as you can see, this is a fluid situation. And right now, as a whole, California is improving and has some of the lowest COVID case counts compared to the rest of the nation. But that's as a whole. And like I said, it really depends when you break it down, look at the counties. So the counties that tend to do better are the ones that have higher vaccination rates as a whole. Next slide. So apologize, it's a little small on the left, but so on the right is showing figures for California as a total, like a breakdown of the hospitalizations, which I went over. But really what I wanted to focus on this slide was on the left, where it breaks down like the number of positive patients by county, and then lists it from like top, like the county with the most positive cases going down. And it's not necessarily based by how many people are in that county, or say, just because a county is larger doesn't necessarily mean they have more cases. So as you can see here, a lot of the counties that are up here are in the Central Valley. So I see Fresno up there, Kern, Sacramento, like northern Central Valley area, if you want to count it, San Joaquin, Tulare. And so as I mentioned, I am with the Fresno County Department of Public Health, and last week I gave a talk with the California Department of Public Health, just letting the public know that in the Central Valley, it's a lot different than the whole total picture, where our hospitals are overwhelmed even at this moment, and we're above capacity. And what that means is that we have a lot of patients, but we needed more staff to come and treat the patients. So there is a healthcare shortage happening in the Central Valley, and already at baseline there's a shortage, but because of COVID, some of these healthcare workers were getting sick themselves and had to go quarantine and get isolated. And there was a period about 2 weeks ago where some of these hospitals had no ICU beds, and they had to transport patients to other counties that had space. So, and critical patients that required ICU care. Right now, in several of these counties in Central Valley, they have an assess and refer policy for the emergency, like ambulance services, where if they get a call, the paramedics arrive, and if it's not an emergency, then these patients are told to go to either urgent care or somewhere else, because the emergency rooms are so packed right now. And so, as I mentioned, I just wanted to show that, yes, as a whole, California is doing better, but there's pockets, especially here, where a lot of our ag, which are a lot of our ag counties here in Central Valley, it's a very different scenario. And last week or so, we had about 170 travel nurses come from all over the state and nation to come help the hospitals. And that was just for Fresno, but Madera, Tulare, Kern, similar. They got a lot of travel nurses. We had medical teams from the California National Guard arrive in the prior week also to help out. So I just wanted to leave you with that it's very important as employers to really get that message out to your employees, the importance to get vaccinated. And I know my colleague Maria afterwards will give you some tips on how they have helped improve that health education about COVID. But as a public health physician, it's just very, very concerning to see this critical situation play out. And again, a lot of it is preventable because now we have these really safe and effective vaccines. But this is the current scenario and we're following it closely. Next slide.
So I just wanted to pop in, Dr. Solis,
yes.
Para recordarles que le estamos ofreciendo interpretación en español si quieren escoger el globo y elegir español. Just for those who showed up late. And Dr. Solis, we're a little fast for the translator. So if you can slow down a bit. Thanks so much. Sorry for the interruption.
No worries. Okay, so in this next slide, I also taken from the California Department of Public Health, it breaks down unvaccinated and vaccinated cases in California. And I wanted to show you there's a big difference between those who are unvaccinated and how, again, they're more likely to get infected with COVID. So the red line is unvaccinated. And this is looking at data from May to September of this year, there was a large increase, as I mentioned, because of the Delta variant, and there was a surge in California. And in the blue line, yes, it is possible for, even though if you've been vaccinated, to get infected with COVID, and we call that a breakthrough case. But in general, when that happens, those people tend to have more mild symptoms, and they don't tend to be hospitalized or die from COVID. And that's really what we say. These vaccines are very effective at preventing severe illness. And even though no vaccine is 100% effective, these COVID vaccines are very effective compared to the other vaccines we have for other diseases. And so per the California Department of Public Health, they said unvaccinated people were 7.9 times more likely to get COVID than fully vaccinated people. And even the CDC said a few weeks ago, I think it was around late July, that when they looked at data from hospitals around the country, more than 97% of those people hospitalized due to COVID were unvaccinated. So very important. Just again, I'm trying to emphasize how safe and effective these vaccines are. And recently, in the last few days, so 78.1% of those eligible in California to receive the COVID vaccine, so that's 12 years and older, have received at least one dose, so 78%. So overall, as a state, that's very high, and that's great. But again, when you break it down by counties, there's huge differences. There's some counties up in the Bay that are high, close to this state average versus, as I mentioned, in the Central Valley, it tends to be lower than the overall state average. So it's just very important that we keep sending that message to our either employees or just community residents, patients, whoever we're working with, that it's very important to get vaccinated. Next slide. All right, so I wanted to go over some common themes that I get asked a lot when I'm out in the community talking or with patients and so forth. So number one is the COVID variants. And I wanted to explain what are variants, how do they happen? So in general, let's take a step back. There's this virus called SARS-CoV-2, and this is a virus that causes COVID-19. It's natural for viruses to change through mutations. So every time it changes, we call that a mutation. And when a new strain of that virus is formed, we call it a variant. Anytime someone gets infected with COVID or the SARS-CoV-2 virus and the virus replicates in their body, it replicates really fast. And sometimes that causes a mistake or a mutation. So really, anytime anyone gets infected, there's always a chance to have a variant develop. And that's why it's our goal with getting vaccinated. It stops that person from getting infected. So if we stop the spreading of the virus, there's less likely to develop variants. And the CDC, like scientists at the CDC, are really they're constantly testing the different well, when people get infected, we send these tests to the labs, and they're really checking for variants, like a certain part of that strain to see. Let me rephrase that. So really what we're trying to do is, yes, there's going to be a bunch of variants, but variants become dangerous when certain parts of them change. The parts where how they infect humans. So if they develop a mutation or a change in that part, it can get concerning. What's really worrisome is if there's a variant in the future that develops and can not cause the vaccines to work. We're not there yet, that is not happening, but we want to prevent that from happening. And the way that happens is everyone who's eligible, as much as possible, please get vaccinated. That way it stops the spread of the virus between people, and that will cause less variants to develop. So just wanted to explain that. And again, really right now, the variant that we're watching here in the US and California is the Delta variant. As I mentioned, it really made its presence and became dominant in the summer around late July, August. And we're concerned because it's shown to be twice as contagious as other variants. So in the beginning, the previous virus that caused COVID-19, if you got sick, you can infect maybe 1 or 2 people. With the Delta variant, if you get sick, you can spread it instead of 2 people, you can spread it to 6. And so that's what's so concerning, that it spreads so quickly, and again, mainly infects those people who are unvaccinated. And we're still observing to see if it overall causes more severe illness. And we're starting to see that, yes, that is starting to happen, but we're gathering more data. But we do know that it is very contagious. Next slide. Alrighty, so just symptoms in general. I know by this point, many of us are familiar with COVID symptoms, but as a reminder, fevers, chills, cough, sore throat, headache, loss of smell or taste, difficulty breathing, nausea, vomiting, diarrhea. So these are all symptoms that can associate with COVID, but some people may have no symptoms. Some people may have just a few of these symptoms. And with the Delta variant, we're starting to see people have more of a cold symptoms, cough, sore throat, things like that. So it's always just a good idea to remind your employees, if you're having symptoms, please stay home, go get tested. I know there's some employers that are still doing temperature checks or so forth, or just asking employees, hey, do you have these symptoms? So everyone has different ways of going about it, but it's just a good reminder, because as I just mentioned, Delta variant is very prevalent in our communities, and you wouldn't want that to spread and cause an outbreak at your workplaces. That's why it's a reminder to tell everyone, please, if you have symptoms, stay home. So I just wanted to remind you, these are common symptoms. And now with the flu season coming up, some of these symptoms are very similar. So either way, we always tell individuals, if you're sick, go get tested, see if it's COVID or not. And it's just always a good idea to be safe. Next slide. And again, the message about staying home, get tested, that's what we've been saying here at the department to the public, especially not only with employers, but with kids going back to school. It's just, please, stay home. And if you don't know where to get a free COVID test in general, we refer people to the local health department's website. Usually they have a list of where to go in the community, or they can also go to see their local or urgent care or doctor's office. Next slide. And precautions, so there's a lot of great education materials out there about how to protect yourself from COVID. Number 1, get vaccinated, wearing a mask that covers your face, your nose and mouth, watching your distance, washing your hands frequently, and avoid large gatherings. And I know my colleague again, Maria, will talk about some educational materials and where you can go get them. But at least from my experience working with employers out here in Fresno County, many have found putting them in common walkways where employers pass by, or in the break room, or even word of mouth. I had one farmer tell me he told his supervisors, hey, when you meet with your crew, just talk about the vaccines. Hey, have you guys been vaccinated? It might be a good idea. If you haven't, if you're still interested, and so forth. So really, he said just communication was really helpful in his workplace. So just throwing out some ideas. But next slide. Alrighty, and just a reminder about registering for COVID vaccines. There's the website for California, myturn.ca.gov. There's also a telephone number where there's different languages. So at the very least, it might be helpful to even have like a flyer such as this up in the workplace. That way people know where to go. And again, I'll leave that for my colleague Maria. She'll go more into that. Okay. So other common questions I get from the community is about these vaccines. How safe are they? How do they work? So I just want to give a big overview with, in general, the coronavirus that causes COVID-19 has spikes all around it. And the virus uses those spikes to enter the cells in our body and infect us. But so these vaccines, Pfizer, Moderna, they use similar mechanisms where they contain a message, an RNA message that goes into our bodies, and it's not a live virus. It doesn't contain the virus that causes COVID-19. So a lot of people think, oh, I'm getting infected with COVID. That's not true. It contains a little message that tells your body how to make the spikes, not the virus. And once your body gets that message, this RNA message gets disintegrated in your body. It doesn't go into your DNA. It doesn't mess with your DNA. So I know there's a common myth out there that, oh, the vaccines change your DNA. That is a myth. It doesn't give you COVID. And then when your body, it tells you, when it teaches your body how to make these spikes, in the future, if you were to come up across COVID or one of its variants, your body's immune system recognizes these spikes and attacks it. So a lot of times people worry when they have common side effects after getting the vaccine, that means they got COVID, and that's not true. I always tell them, if you do develop side effects after the vaccine, which is more common after the second dose, it just means that your immune system is developing protection against the virus. And that's what we want. We want your body to get protected, but not everyone gets side effects. And if you don't, it doesn't mean that your body, it didn't work. It's just everyone's immune system is different. But just wanted to share, because this is a common question I get, and that way you understand how they work. Next slide. And then our other vaccine available is the Johnson & Johnson vaccine. This one is a little different than Pfizer and Moderna because it uses a harmless inactivated cold virus to carry the gene for the similar thing, the coronavirus spike protein. So again, it doesn't carry the actual virus, but it only tells your body how to make these spike proteins, but it does it in a different way. Instead of a RNA message, this one uses an inactivated cold virus. And there's other vaccines that we have available for the general public for other diseases that uses similar technology. And so, yeah, so it teaches your body how to recognize the spikes and kill the virus. And I know I've gotten a lot of questions like, wow, these vaccines were made awfully fast, like that's concerning, but I just want to let you all know that that's actually not true, that a lot of this technology that we've used for these vaccines, they have been in research for years. And the government invested a lot of time and energy and told scientists, okay, really focus on this because it was a global emergency and a lot of people were dying from COVID, due to COVID at the beginning of the pandemic. So just wanted to reassure you that a lot of this was based on safe scientific studies that had been going on for years. Next slide. Alrighty, so just a summary. Right now, these vaccines are available for individuals 12 years and older, and 12 through 17, it's only Pfizer, but 18 and over, anyone can get any of the vaccines. So Pfizer, Moderna, and Johnson & Johnson. Today, this morning, the Pfizer announced that they are sending their data for their clinical trials for kids 5 to 11 years old. And they're going to be sending it to the FDA for their review. And as we all know, so it's a process. Usually once the FDA gets data from clinical trials, they'll review it. And then they'll have a panel of experts looking it over. And they're applying for emergency use authorization. So to see if 5 to 11-year-olds are eligible to now get it. And then the CDC, a separate health agency, will review the information and make a final recommendation. So it is a process and likely will take a couple weeks before we get a final green light. But I know after speaking with a lot of parents in the community, that they're hopeful for this because as a lot of kids have returned to in-person learning, they want their kids to be safer and get vaccinated. So that is a new announcement that came out today. And again, what Pfizer said is that the data for their kids 5 to 11 years old show that not only the vaccines are safe, but that they showed similar immune protection as we saw in adolescents and young adults. So that's good to know. So we'll be following that shortly. So hopefully we'll learn more information about that. And I just want to remind everyone again that these vaccines are very effective at preventing severe illness, such as hospitalizations and death due to COVID. And they're similarly protective across age, gender, and race. Another common question now is, well, when are you considered fully vaccinated? And as a reminder, that's 2 weeks after the second dose of Pfizer or Moderna. And it's very important that individuals get their second dose for these vaccines to get the full protection of the vaccine. I've spoken to people in the community who are worried about the side effects, and I remind them that really, if you do have side effects, that just means your body is getting that protection that you want from these vaccines, or 2 weeks after a single dose of the Johnson & Johnson vaccine. And then I wanted to leave with the message that current evidence show that COVID vaccines still provide valuable protection from the COVID variant. So not only do they help you about the original strain, but also the variants. I do want to make a comment that, another question that I get around this is, well, if I've already had COVID, I don't need the vaccines. And I just want to emphasize that we don't know, we're still learning how long natural immunity lasts. And now with all these variants, your natural immunity may not protect you against like Delta and so forth. So what we're learning is that people tend to have longer protection from the vaccine, not only against the original virus, but the variants as well. Next slide. Okay. So sorry that this is so wordy, but I'm going to try to break it down. So I've been getting a lot of questions. As we know, this last 2 weeks, there's been a lot of movement with the boosters and what's going on, what to expect. So let me start off by first clarifying. Sometimes we use the phrase third dose, and sometimes we use the phrase booster. When we say third dose, really we're talking about a small group of population who has compromised immune systems. These are individuals who, for example, are sick with cancer and are receiving chemotherapy, if they had a recent organ transplant or advanced HIV. In that case, the data show that these individuals didn't develop a full immune response, like a large antibody boost that we usually saw in people with normal, healthy immune systems. And so for these people, they're more vulnerable and at risk of getting sick. And so a couple weeks ago, the FDA gave emergency use authorization for these individuals who receive Pfizer or Moderna to be able to receive a third dose of the vaccine 28 days after their second dose. So this has already been happening for the past couple of weeks, but again, it's only for that small group of population who has very severe immunocompromised conditions. And we call it third dose because they never really had that boost of protection from the beginning because their immune systems were a bit weaker compared to normal healthy immune systems. So that's one thing. But booster dose is for those individuals who have normal, healthier immune systems, and they did build enough protection. And so after their second dose of Pfizer or Moderna or a dose of Johnson & Johnson, we did see high levels of antibodies, but Pfizer and the Moderna, they're doing clinical trials, and Johnson & Johnson, they've been monitoring, and over time, we're seeing that some of these individuals can have a decrease in their antibodies over time. And so this is why this discussion of booster dose came up, like who needs a booster dose, how much time after the second dose of Pfizer, Moderna, or one dose of the Johnson & Johnson. So this is why there's been a lot of discussion, because everything we do, we want to base it off data and clinical trials. And so Pfizer was the first pharmaceutical company to submit their clinical trials data, because you have to have a certain amount of time and participants of who they're following. And Moderna and Johnson & Johnson are also collecting their data to submit to the FDA. So it's really a process, and it's very transparent, like as we saw in the past week. a panel of experts from the FDA and a panel of experts from the CDC. And even on the West Coast, we have a panel of experts called the Western State Scientific Review that independently looks at this data and gives recommendations on whether we should proceed. So just to give you a summary of the whole process, so last week, the FDA panel met and reviewed the data from Pfizer, CDC panel met as well, and the Western States Scientific Review, and they all recommended that the following people who receive Pfizer vaccine, so again, this is only about Pfizer vaccine, are eligible to receive a booster dose 6 months after their second dose. And when we read the CDC or FDA guidelines, it separates it versus should versus may. But I think it's easier to understand, like, these are the people who are eligible to get it. So anyone above 65, individuals 18 years and older living in a long-term care facility, and people 50 to 64 with underlying medical conditions. CDC has a list of that, but just to give you some examples, this could be diabetes, obesity, and so forth, should receive a Pfizer booster. And then they broke it down for these other individuals where it could be may, based off the individual benefits and risk. But I think it's easier to understand that anyone here is eligible not to get a booster. So people age 18 to 49, also with underlying medical conditions. So similar to what I said, obesity, diabetes, anything where it may suppress your immune system, chronic kidney disease, things like that. Again, it's all 6 months after your second dose is the minimum interval. And then this last part really applies to this group, individuals age 18 to 64 who are at increased risk for COVID exposure and transmission because of occupation or institutional setting may receive a Pfizer booster dose at 6 months after their second dose. And so the CDC did give a list, preliminary list of what counts under this, and they did mention food and ag workers, teachers, our frontline workers, which include our healthcare workers, paramedics, firefighters, police, some in like transportation. So anywhere where they're dealing where, you're in close quarters or dealing with a lot of people, those are individuals that are considered at risk. So again, this was just recently announced and only for Pfizer. So right now the CDC is not recommending that you should not mix doses, or for example, if you had Moderna, you shouldn't mix and get a Pfizer booster, or same with Johnson Johnson. I think it's very important to stress to the employees that Pfizer, Moderna are gathering their information, and we should be hearing whether a booster dose will be approved for them over the next few weeks. So it's just a good idea in general to remind them to our employees or just people in the community, continue with the mask wearing, especially indoors where the risk is higher to get infected, avoiding large gatherings, because I don't want them to feel like they're being left out for for Moderna and Johnson Johnson. But again, we want to make decisions based off data, and that's what we're gathering at the moment. But so for now, this is only for Pfizer, and at least here in Fresno County, we are starting to advise our ag employers to, if you did have a workplace COVID vaccine event, might be a good idea to contact your medical provider, because a lot of them are busy doing a lot of events, so that way they have it on their calendar. And education about the importance of boosters. And I know that several organizations are working on booster educational flyers that you can post up, because I know that there's a lot of questions around it. It just came out last week, but I just wanted to give you an overview. It's a lot to see here, but hopefully that gives you a good summary. And again, I'll be taking any questions next. I think that's it. Yeah, so again, thank you for your time. It was great speaking with you all and giving you an overview what's happening with COVID, not only overall in California, but in the Central Valley, and just some of the new developments happening with the vaccines. But yeah, Kimberly, I don't know if we have any.
We have a couple questions. Thank you so much, Dr. Solis. Sure. So here's an easy one. Can rapid tests detect current COVID infection?
Yeah, so rapid tests can affect current COVID infections. But usually rapid tests are a lot better for people who have symptoms. So they tend to be more accurate if you have symptoms. So we use them a lot, like in the clinics, where people coming in with symptoms and we want to know, is this COVID or is this something else, flu or allergies, things like that. So they can work with that. But if you don't have symptoms, sometimes some providers may follow that up with a PCR test. So let's say you were exposed or don't really have symptoms but are worried, then so there's two types of tests. One is the rapid one where you can usually get the results within 15 minutes, or a PCR test where they send it to a lab, and that one can take 2 to 3 days, but that one is considered gold standard and has less false negatives and things like that. So you may see some providers using one or the other or both just to double check, but rapid tests can work, but more do work, but are considered more effective in people who have some symptoms.
I think you touched on this a little, but our next question is, if you do test positive with the over-the-counter COVID test, do you recommend getting another one to confirm from an actual medical facility?
Well, it's tough because right now there are a lot over the counter, and I'm not sure how accurate the ones over the counter are, to be honest. But I do feel that sometimes it can be, if you are able, I think it depends. Sometimes I hear from patients saying, hey, it's so hard to get an appointment and this and that. But if you are having symptoms or were exposed and that test positive, then it might be a good idea, if you are not able to speak with your doctor, to definitely start isolating yourself, which means avoid being around other people, avoid going to work, because usually they recommend isolating for 10 days. And you can always, if you want to confirm it, go get a PCR test, which is, again, usually offered at many COVID testing centers. But in general, if you were exposed or having symptoms and it's positive over the counter, I would start isolation, and you can definitely confirm it with a PCR, but better to be safe, as I was mentioning, and not go to work at that time.
Is there such a thing as a rapid false positive test, or I guess result for the test?
It's more in people who don't have symptoms, where that might be a higher possibility of being a false test. So again, these rapid tests work better if you have symptoms. If you don't, that's a lot of our community partners, at least here in Fresno, I know in other counties, double check with a PCR, which is the swab that they send out to a lab that takes 2 to 3 days. So it really depends on the patient's story and history, and then the providers can make a better decision. But yeah, it is possible to have false negative, but again, more common if you don't have symptoms, and it really depends on the story. And so as a doctor, we have like a algorithm of what we go through, but it is possible.
All right, just a couple more questions before we invite Maria up. What is the best timing to get an accurate COVID test? They're asking about from when you first have symptoms or you were first exposed to the time you actually take the test. What's that best time frame? We initially heard 1 to 2 days, but now it seems like maybe 3 to 5 days between the exposure or symptoms and then taking that test. What would you recommend?
Yeah, that's a great question. So the CDPH, California Department of Public Health, did put out some guidelines, and they do recommend about 3 to 5 days getting tested after either exposure or, I mean, if you're having symptoms, you should get tested, but usually they would recommend 3 to 5 days before getting tested for COVID.
Okay. If you're vaccinated, and then you also get infected with COVID and test positive, it's definitely COVID. Does that mean you have double immunity, or does it change anything?
Great question. So as I mentioned, it is possible to get COVID after you've been vaccinated. And we call it a breakthrough case if it's been 2 weeks after your final dose of the series. So 2 weeks after Pfizer Moderna second dose, or 2 weeks after Johnson Johnson first dose. So these vaccines are really effective at preventing severe illness like hospitalizations and death, but we're starting to see that they may not be as effective as preventing mild illness. And that's why this whole discussion about boosters came out, because we were starting to see some more infections with mild illness in people who had been vaccinated. So and so if that does happen where you have a breakthrough infection, usually that gets reported to the local health department because we want to track the effectiveness of these vaccines and how often it's happening. But as I mentioned, overall, the majority of the people that are hospitalized did not receive any dose at all of any vaccine. So that still shows you how effective these vaccines are. But in general, if you get infected with COVID, that doesn't mean you have double immunity. It just, it depends. If you got infected with Delta, well, you would have immunity to Delta variant. But again, I would just follow the guidelines for the vaccination process. So if you're due for a booster, well, let me clarify. So if you've been recently infected, usually that gives you, we tell individuals, for example, I'm sorry, I'm trying to clarify this, Kimberly. So in general, let me just make it simple. So if you have been infected and you were vaccinated, it doesn't necessarily mean you got double immunity, but maybe at that time your antibodies were lower and you maybe got infected with Delta. So that means now you're definitely, you'd be protected against Delta. But in the future, let's just say you would be due for a booster or so forth. You should still follow those guidelines. Usually you wait 2 weeks minimum. You have to recuperate from your symptoms and wait 2 weeks from when you were infected or so forth. But just to simplify, it doesn't mean you have double immunity. It just means you're protected against that strain that you got infected with.
Could you clarify the difference between the booster and the third dose?
Sure. So third dose is for those people that are immunocompromised. So it's very for those people who are very just weaker immune systems, like having cancer on chemotherapy, organ transplants, HIV. So for those people, we call it third dose because they never developed that high antibody levels that we saw in normal people with normal immune systems. So those people can get a third dose of Pfizer or Moderna 28 days after their second dose. This is not for J&J yet. We're still doing research on that. But for the booster, it's for people who've had healthy immune systems, who we did see a good level of antibodies, but studies showed over time these antibody levels decrease, and it might be 6 months after their second dose. That's we're recommending for those populations I mentioned, 65 and older, 18 to 64 with chronic conditions, 18 to 64 who work in these certain occupations. Then by getting that boost, that third boost from Pfizer, then it protects you and again gives you the higher level of antibodies to protect you against infection. So that's the big difference.
All right, one more before we bring Maria up. We're going a little over here. If a vaccinated employee is living with a COVID positive person, can they return to the workplace? And anything you would recommend to address that?
So there are guidelines now from CDC, and perhaps Kimberly, afterwards I can send you a nice diagram that talks about what happens, because that's a great question. We get it a lot. And the CDC does say that you should monitor for your symptoms if you've been exposed and you're vaccinated. So I think it will be helpful because that's a very detailed question. But I would say, Kimberly, why don't I send you afterwards like this diagram that you can send out to all of our participants? That way they can go through the scenarios. But in general, that person would need to monitor for symptoms to see if they were to develop any, if they were exposed. But if that vaccinated person starts to develop symptoms, then they need to go quarantine and get tested, as we talked about, 3 to 5 days after that exposure.
That sounds great. Thank you so much for all this information. We will be sharing out recordings of the presentation as well as these additional materials. So thank you so much, Dr. Solis.
Great. Thank you, everyone.
All right, Maria, if you would like to come up, and I remind you, we are recording, so we got to speak a little slower for our interpreter.
Good morning, everyone.
All right, let me share this video here. You want to do any intro or just jump into the video?
Yes, well, actually, we're going to jump into the video because it is 5 minutes, but my name is Maria Ibarra, and I'm an outreach specialist here at California Farmworker Foundation, and I'm excited to share how we can work with our farm workers and facilitate vaccines, especially on a smaller scale, given that thankfully, as soon as vaccines became available, we were able to go ahead and have a large events, work site, community sites, but it's the ones that are kind of, the ones that decided to join later, they wanted to get vaccinated. So we're gonna go ahead and start with this video. It's on myturn.ca.gov. It's the point of this video is to show how easy it is for somebody to sign up for a vaccine. Again, I know that here at CFF, we do have the capacity to take calls all throughout California. Our phone number will be listed at the end of this presentation. We can go ahead and sign up appointments for your workforce. If you have groups of 2 or 3 that wish to get vaccinated, but the resources right now are not available in the county to have a provider go to your work site. Thankfully, you guys can call CFF and we can go ahead and walk you through the process. And if there's another option that we can go ahead and take, you can go ahead and assign a staff member from your organization or your company. It can be your safety coordinator, it can be your HR office. But if we can go ahead and begin this video.
All right, and remember, we got to speak a little slow for our interpreter to keep up here.
I understand.
She has to say more words.
Okay, so again, if somebody were to start or call our office, our call hotline specialist, begin asking them if they would like to have a walk-in or an appointment in their home. And the preferred method has always been an appointment where they get to go to a provider. And then we also have the option of individual or group. That could also fall into a workforce or employees more than one employee. Again, we also ask them as well if they've gotten any type of their first dose to make sure that they also ensure that they get the same type of dose. And again, this is the basic demographic information that they ask. Right here, this is a pretty helpful tip that a lot of growers don't know, or FLCs. There is transportation provided to the farm worker if that is something that I know that a lot of farm workers carpool together. If they were to go ahead and utilize this process, we go ahead and figure out what county they're in, and we go ahead and continue. We provide the zip code. The reason for the zip code is we want to go ahead and find a location closest to the farm worker. It can also be a zip code closest to their work. They can go ahead and let us know then what is their preference of vaccine. And amongst preference of vaccine, they let us know how far away they are from the zip code provided. Again, I know that a lot of farm workers do commute to work. They have that option as well to go ahead and utilize their work zip code. So right here, they're able to go ahead and have their second dose as well allocated, and there's also walk-ins as well. So a lot of farm workers, we see that they don't want to have that commitment of an appointment because again, we have their families to get home, sometimes the traffic, and they don't want to lose their appointment. There are walk-ins available as well. And right here, we're going to go ahead and utilize where we're at here in Delano. So then right here, this is the first appointment. Given that Pfizer Moderna have 2 appointments, it's the flexibility of whatever the time that works for them. And their second appointment is immediately scheduled as well. So right here, we go ahead and verify it's going to be in Wasco. So we're going to utilize my name. So we're going to go ahead and begin Maria Ibarra. That's the good thing about this is that there's no ID required. I know that that's one of the biggest factors of why farm workers are reluctant to get vaccinated. Given that right now we are putting in my date of birth, that's another thing I also recommend to have the farm worker or their employee utilize their date of birth because that is true to their identity. The information is only disclosed to the public health department and the farm worker. If they were to call us, we go ahead and keep that confidential within the farm worker and ourselves. And then we go ahead and ask again, basic demographic information. This is very easy to go ahead and fill out. Again, if you have a group of 2 or 3 farm workers that wish to get vaccinated, and if the workforce has a positive workforce and where they are encouraging of vaccines to remain safety, again, because it's you are go ahead and working to provide for your family, you want to maintain that the safety of your employees and your coworkers. Thankfully, that this demonstration, I hope that it does shine light into a website that is highly promoted all throughout the radios, all throughout TV. It is very simple. So then right here, we begin to put the phone number. So when we put the phone number, the reason for the phone number, it has to be a phone number that receives text messages. Again, I know that sometimes farm workers have to put minutes or their phone is not paid. That is very important that they utilize that because they're going to receive a text message. So then right here, we ask them the basic questions if they have severe allergic reactions. But moving back to the text message that they're going to receive, that takes place of the ID. They're going to receive a unique code to them. So when they do go to the appointment, they can go ahead and verify with the code that they obtain via text message. And right here, we go ahead and let them know that if they need help filling out any information, thankfully, these locations, they want to go ahead and provide easy access if there's any accommodations that they can do. So then right here, we go ahead and right here is the basic information of what to bring for a vaccine. Thankfully, now that there is a booster option available as well. So if you do have older farm workers or older employees, myturn.gov also has that option as well. They also have the option to do home vaccines. If you know that a farm worker is a little bit reluctant to get vaccinated because of time off, given that on September 30th, it will no longer be available, the 2 weeks that's set to be expired on September 31st. But the great thing is that there is an option to get vaccinated at home. So per se that they're getting off of work and they're off at 2 o'clock, they can go ahead and have a healthcare provider. It can be from a pharmacy or local clinic. They can show up to their house after work and they can get vaccinated. That's another great thing that we have seen that a lot of farm workers have been utilizing. But the message to go ahead and facilitate vaccines is if the supervisors, foremen, leads, managers, if it's all a positive environment from leadership and there's an established trusting environment, we do see that there is a higher number of vaccines amongst that company. The good thing is that right now with all that the boosters, the farm workers are asking more, like, what is this booster about? Is this something that I do need? And thankfully, it is something for the farm workers that with high immune systems, 65 years and older. And thankfully, CFF can go ahead and help with that. Again, if Kimberly, if you would like to jump to the flyer where it has our phone number listed. So right here, 559-710-2000, we can go ahead and help. It's our hotline that's available from 8 a.m. to 7 p.m. It gives time farm workers to go ahead and call after work, or they can call before work or on. We're not available on the weekend, but thankfully we do see calls in the afternoon. We see them go up maybe around 3 or 4. So that gives us an indication that it is beneficial to them to have the hours later. Another thing I also want to touch up on that we also provide a train the trainer CFF, the train the trainer COVID testing, as Dr. Solis had mentioned. We also have capacity to go ahead and provide training to your workforce, to designated individuals, designated staff, to go ahead and conduct PCR and rapid testing. Again, unfortunately, we don't have the capacity to go all throughout the state of California, but what we can is, we are on Zoom, we are on pandemic, we are everything online, and thankfully it has been a method that has been useful, and it's been proven that it is effective for us to go ahead and use as a training to provide that to growers and to FLCs that want to remain a safe work environment for their farm workers. Those are the key things to go ahead and facilitate vaccines amongst farm workers. Another great thing is team up with your public health department. You guys are a team. We are all partners. If you would like to designate again your safety coordinator to make the relationship with an outreach with the COVID team that was created in your county for the public health department, they have all the knowledge of where all vaccines are taking place. They have all the knowledge of what is the best what is the quickest place or what is the next best place to go ahead and get COVID tested that's available to the farm worker. And we also have that information as well too, 559-710-2000. We do know that sometimes it is a little bit intimidating to talk to a large organization. Thankfully, we do have that trust that we want to ensure that if our farm worker calls our number, we want to go ahead and provide the best customer service to them and letting them know that all the information that they're giving us, we're going to go ahead and provide the most easy and accessible vaccine appointment, COVID testing for them or for their child, given if it's not available for children younger than 18 years old. Another thing that I also want to Dr. Solis had mentioned this as well, having a bulletin board with updated information and events closest to your workforce. So if you identify that your workforce comes mainly from, for example, Delano, we can go ahead and a thing that we have mentioned to other FLCs and growers is to have events for Delano available. So I know that here in the Delano School District, they do utilize the weekends parking lot for vaccines and COVID testing. Again, it's kind of making a personalized bulletin board where it's a high traffic area. It can be in the break room where you have updated current information of where they can find vaccine events, where they can find COVID testing events, because there are a lot of vaccine events taking place. But just the fact that they see it's a personalized, they'll be able to recognize, they'll be able to have that connection, like, oh, that isn't Delano, that's where I live. That's actually 2 blocks from my house. That does make an impact. Again, finding events closest to the zip code where your workforce is coming. If your workforce is generally kind of more than 5 zip codes, then ideally have a predominantly one where you can go ahead and by all means, go ahead and have our flyer here, the information provided, our 559-710-2000. We're more than happy to go ahead and provide that assistance to growers and FLCs. Again, right now with resources spread very thin, as Dr. Solis had mentioned in a conversation that we had before, it is not feasible right now to have a worksite vaccine event. We did have those in the very beginning once vaccines were available, but as of right now with we're making the push to have more farm workers get vaccinated, to have their children be vaccinated. Unfortunately, that doesn't make the resources as available as they were in the beginning, but thankfully there are events taking place. We are here, CFF is here to go ahead and provide that help or bridge the gap with FLCs and growers to go ahead and again, provide our phone number. We can go ahead and sign them up for appointments. If you were to call us and give us 14 or 15 farm workers that wish to get vaccinated, and unfortunately you don't have the staff to go ahead and allocate that time to register them, we are here to go ahead and provide that help. I hope I did not talk too fast, Kimberly. I feel like I caught myself right now, but I think that is just the hindsight of what I would wanted to share, that it is easy to go ahead and begin the conversation of developing a trustworthy environment to where your farm worker does want to get vaccinated. Again, it starts from the top, and the leaders of the company and the leaders of growers and the leaders of the FLCs, if the employee sees that their boss or if the owner has a positive message towards vaccine, there is that trust, because essentially the farm worker is working to provide for their family, and they do trust their employer. And it's just it's up to us to go ahead and nurture that trust. It's up to the grower, it's up to the FLC to go ahead and establish that confidence that we'll work together and we'll team up with whatever organizations are available in our county. There are a lot of organizations that have always the best intentions to help. So thankfully, if there are any questions, I hope I didn't talk too fast. I hope you guys all understood the video. Thankfully, Kimberly will make that available for you guys. But Kimberly, if there are
we have a couple of questions for you, Maria. Thank you. So that video that we were showing in the beginning, is that available in Spanish? When you're going through all the information is always in English. Is there an option for a Spanish one?
Yes, actually, if you would like, I can go ahead and send to you the Spanish version. At the very top of the website where it says my turn and it says the title, on the right hand side, it gives the option to change it in the language. There are many languages available, and I will go ahead and send you a demo of exactly the screen recording, the exact same steps, so you can go ahead and share with the attendees.
Great. And we think that's also really nice. I know a lot of times I start a process, and if I don't know how long it's going to be and what information they're going to request, sometimes that can be a deterrent. So having all that information, you already know everything that's going to be requested in advance, is really helpful. So thank you for making that.
It does help a lot, because essentially it does, again, it feels a little bit intimidating when you want to go ahead and begin to navigate a website that you don't want to make a mistake on, because essentially you're signing up a Farmworker for, but thankfully, hopefully this helps.
It is 10 o'clock, but we're going to go a couple minutes over because I'd really like to get to these audience questions. There's just a few. Someone says they missed the name of the entity that goes to the workers' homes to apply the vaccination. You mentioned that there's actually sometimes the ability for them to come to their home for to help vaccinate them. Could you expand on that?
Yes. So for that option of the home, it's with 3 other options. If they would like to utilize a walk-in, if they would like to utilize an appointment, or they would actually would like to have a home visit of an appointment. When you
that's just through the myturn.gov, that same option all there.
Correct. When you go ahead and click that option, and I'll go ahead and send you a little bit more detailed, just focusing on the home, it gives you available providers in the zip code area that are able to go ahead and go to the home.
Okay, excellent. Yeah, as Maria mentioned and Dr. Solis, we will be following up with these additional resources, so check your inbox later today. Interesting question here. I'm very curious, which immunization are farm workers asking for? Are they more interested in Pfizer, Moderna, Johnson & Johnson, or have you seen any variation there?
It shifted a lot. In the beginning year, when the vaccines were available, they were very interested in the Johnson & Johnson. And the reason we collect the data and we want to know why they are pricking the Johnson & Johnson. And it's because it was the 1 dose. It was easy for them to go ahead and just take care of it, done deal, you're done. But now, as we see that the Pfizer has been available, or the conversations have been available that the Pfizer is preferred, it's a preferred amongst farm workers. There is a few myths going around of the different types of vaccines, but as of right now, in-house, our calls, the preference is a Pfizer as well, the Pfizer vaccine, and especially now with the Pfizer booster available.
That's really interesting. All right, we've got one more question here, just going a couple minutes over. You mentioned that the CFF, California Farm Worker Foundation, not only can you help with vaccines, but then you can also help with testing. And you mentioned that CFF can actually help train their staff to conduct this testing. So when CFF has trained their staff to conduct the testing for their site, how many testing kits are provided to that company when they're trained to conduct the testing?
They are provided with as many as they need for their workforce. So if, for example, here in Kern County, we provide with the amount of inside the crew, like the cuadrilla, that's how many we provide. But if it's for the workforce, if it's your entire workforce, and we provided over 700, 800 to a grower, for example, in Fresno County, Thankfully, they've been able to work with the 800 testing kits that we provided. And as soon as they feel that they're going lower on supplies, they just give us a call. We're gladly to ship them, or we're gladly to take that drive over there. But thankfully, they have been so helpful, and they're actually willing to drive all the way to our office here in Delano to pick it up. But as many as your workforce is actually employed, and as many as you would need provided to go ahead and prevent an outbreak, or to go ahead and facilitate an outbreak that has occurred.
All right, well, that's all of our questions, and we are over time. So thank you so much, Maria, for sharing this with us. We will, as I said, share out these resources so you can reach out to CFF, follow up with My Turn, whatever is most efficient for you and your workers. I also want to give a huge thanks to Clara, our interpreter, keeping up with us today. You're fantastic. Thank you so much. And we also give a huge thanks to our sponsor of this webinar, who helped us bring you this information at no cost to you either, the Western Center for Agricultural Health and Safety with UC Davis. Thank you so much for their support. And thank you to our other presenter, Dr. Solis, and thank you to all of you for being with us today. We really appreciate your time. I put in the questions earlier. We have another webinar on October 5th, which is also free, and it will be addressing more the legal aspect, the changes coming from Cal OSHA, federal OSHA, as well as the state. So please check out that webinar, sign up, and we will hopefully see you next week. Thank you so much, everyone. Have a great day.
Thank you.